Also want to mention RSV, or respiratory syncytial virus. Across all of our hospitals, we've seen increased numbers of hospitalizations due to respiratory syncytial virus, the significant impact to the number of available hospital beds for children. While RSV disproportionately affects young children, it's really been thought of as a childhood disease for a long time. Elderly adults are also at risk, as are those with some chronic health problems like chronic heart problems or chronic lung problems. RSV can actually be more serious than influenza for children and elderly adults and can lead to severe infections that may require hospitalization, like bronchiolitis. That's an inflammation of the airways. It's particularly problematic for children who have small airways, can also cause pneumonia. We've been seeing that. So if you or your child is not feeling well, we encourage people to stay home, continue to practice good hand hygiene, and cover your mouth and nose when you cough or sneeze. While there's currently no vaccine for RSV, there are multiple RSV vaccines in development, and we're hopeful to have one sometime in 2023. So if you think your child could be sick with respiratory virus, we encourage you to call your pediatrician to get advice on next steps. So just a couple more comments, and then we'll open this to questions. While I anticipate some increase in COVID activity through the winter months, I do not anticipate we will have the kind of spike we had in January of 2022 when we had that big Omicron variant spike. However, we have a combination of COVID, influenza, RSV all together, as well as several other respiratory viruses. This is likely going to be a very challenging respiratory virus season because of the combination of all those viruses that'll be out there and are currently out there. And one other comment about vaccines for influenza and COVID, often people think of these vaccines as just a way to protect themselves from viral infections. However, we know that both influenza and COVID can have downstream effects, and there's an association with heart attacks and strokes in the weeks after someone has the flu or they have COVID. So when you get the flu or you get COVID, your body creates a lot of inflammation, and that can lead to vascular issues like heart attacks. So if you talk to physicians who work in the emergency department during a flu season, they will tell you it's not uncommon for people to come in with a heart attack who then tell them they had the flu a couple of weeks ago. So vaccines not only protect you from getting infections, they may protect you from severe consequences in the weeks after that infection. And that is really important if you already have risk factors for things like heart attack or stroke, like you have diabetes or high blood pressure, or already have heart and lung problems. So we would encourage people to really strongly consider getting vaccination.